If you have knowledge, let others light their candle in it. Warm greeting to all. It is fantastic to see such a strong turnout today, and we genuinely value your commitment and energy. Your participation is what truly elevated this event and contributed to its success. On behalf of the and organizing committee, I am this opportunity to welcome you all to this third series of International Pre-Conference Webinar 2024. In our rapidly evolving field, tools like virtual reality and artificial intelligence are enhancing not only our clinical skills, but also our ability to communicate and connect with the patient. Virtual reality allows nurses to practice sensitive conversation in a safe, immersive setting, while AI-driven platform offers personalized feedback to refine communication strategy. Telehealth technologies are further transforming patient care by requiring us to adapt our interpersonal skills for the virtual interaction, ensuring empathy and clarity by integrating these innovations in our training. We enhance your technical skills, build stronger connection with those we care for, paving the way for more compassionate and effective healthcare setting. A speaker is someone who can take complex idea and make it into simple. Now it's time to express our deepest gratitude for welcoming today's speaker, Ms. Lauren Magdan, Production Manager, via Scenario, Authorizing Specialist at CIMAX. For your valuable time to be here with us, ma'am, we are excited to have you as our resource person and eagerly await the knowledge and the perspectives you will bring. Your contribution will enhance our event and deepen our learning. Welcome, ma'am.
Thank you so much.
We please Mr. Joseph Tribble, Director, Relationships CIMAX USA. Appreciate your role in facilitating our communication. Your presence and support will be invaluable in ensuring everything runs smoothly and effectively. Welcome, sir.
Thank you. Thank you.
I would like to give warm welcome to Ms. Kajal Bale, Director of Nursing Innovation and Strategy, CIMAX. Welcome, ma'am. I extend a warm welcome to Dr. Mohini, Principal, SDS and TRC, RGCIG College of Nursing, Bangalore, who is serving as a Karnataka Nursing Council Observer for this webinar. Your presence is greatly valued and we are honored to have you with us. Welcome, ma'am.
Thank you, madam. I'm not seen, madam.
Sorry, ma'am, I couldn't hear.
Yeah, video is not enabled. Video, this is from Dr. Mohini. And that option is not. Okay, continue, ma'am.
But empowering students and faculty to become the leader of tomorrow. It is my privilege to welcome Dr. Devi Samuel, Principal, KrupaNucon College of Nursing, whose leadership and dedication have greatly impacted our college as well as the event organized by our institution. We are honored to have you, ma'am, with us today and look forward to your insight. Welcome, ma'am.
Thank you. Thank you, ma'am.
Mentoring is a brain to pick and ear to listen and push in the right direction. I would like to heartfelt welcome our Vice Principal, Dr. Prabalis Thomas, Organizing Secretary for this webinar. On the behalf of our entire team, I genuinely appreciate all the hard work and dedication you have invested in making this event tremendous success. Welcome, ma'am. It is my pleasure to welcome Ms. Shashigala, Assistant Professor, KrupaNucon College of Nursing, who is serving as a moderator of today's webinar. Welcome, ma'am. Last, not the least, dear delegates, I am delighted to extend warm welcome to everyone. Join us for the International Pre-Conference webinar. It is a joy to share the virtual space with such a distinguished group of professionals from various industries across the world. I am confident that in the coming hours, our distinguished speaker will offer valuable insight and expertise on emerging technology in development of interprofessional skills for nurses. We believe that the knowledge and perspectives exchanged by today will be incredibly beneficial for everyone involved. I encourage you to participate actively by asking questions and contributing to the discussion and seizing this opportunity both to learn and to network with the fellow attendees. Thank you. Have a wonderful session.
Thank you, Liji ma'am, for such a heartwarming welcome. Now I request our beloved principal, Dr. Devi Samuel, to address our gathering.
Good evening to today's speaker, Ms. Lauren, and all our respected dignitaries and professionals, and a very good morning to all the participants. On behalf of KrupaNucon College of Nursing, I take immense pleasure to welcome each and every one of you for this third international webinar series. Well, today's topic is on emerging technologies, development of interpersonal skills for nurses is the need of the hour. The technologies like virtual reality, simulation-based training are reshaping the way nurses collaborate with the other healthcare professionals and also enhancing the teamwork, communication, and patient care. So let us listen to the panel of experts how these technologies are the advancements are going to prepare the next generation nurses for a dynamic interpersonal healthcare environment. I wholeheartedly thank the focus group and CIMEX team for organizing these 3 international webinar series for us. And I once again welcome the speakers. And also believe me, today this webinar is going to be a great learning for each and every one of us. So thank you all. Thank you so much. And I welcome each and every one of you for this international webinar. Thank you. Over to the team.
Thank you, ma'am. So introducing myself, I'm Ms. Shashikala, and I'm delighted to be the moderator of today's webinar. And on behalf of the organizing team, I would extend a warm welcome to all the joinees from the different parts of the world. The topic we are exploring today is very timely and very crucial, emerging technologies in the development of interprofessional skills for nurses. As a healthcare professional, we have to strive to continuously evolve, and so does the nurses need to adapt and enhance their interprofessional skills using the latest technologies. Today, we will dive into how these emerging technologies and platforms are shaping the future of education and practice. We have amongst us an eminent speaker who is eager to share her knowledge and insights, that is Ms. Lauren Malgren. Ms. Lauren is a production manager at CIMEX, where she manages the operations for creating virtual reality training simulation. She is with experience in internal medicine and a Bachelor of Science in Nursing from Brigham Young University, Provo, Utah. She is passionate about the advancement in medical simulation technology and contributing to development of healthcare professionals. Lauren currently lives in Salt Lake City, Utah, and enjoys skiing in the beautiful mountains and playing tennis with her husband. Please join me in welcoming Ms. Lauren, and over to you, ma'am, for the session.
Wonderful. Thank you so much for that lovely introduction. I will share my screen here. And we'll go ahead and get started. All right. Can everyone see my screen okay?
Yes, ma'am.
Wonderful. Well, again, thank you so much for that lovely introduction. I am absolutely thrilled to be here with you this morning, and grateful for this opportunity to speak about something that I feel very passionate about. So as introduced, we will be discussing emerging technologies in the development of interprofessional skills for nurses. And a brief disclosure, I am employed at CIMEX currently, and I do receive a salary from them. So this live presentation will describe and demonstrate the ways that virtual reality simulation technology can support multiplayer learning to encourage development of interprofessional skills, interdisciplinary communication, and team collaboration. As we go along, please utilize the chat and add any questions that you have there, and we can answer those at the end of the session. So during this presentation, we're going to define interprofessional education. We'll examine how virtual reality can facilitate team-based multiplayer learning opportunities. And we will identify applications for multiplayer VR in nursing. So first, what is interprofessional education? It is defined as when two or more professions collaborate to learn from and about each other to improve care. And we know that we don't take care of patients by ourselves. We take care of patients in teams. And those teams are made up of a variety of different professions that all contribute to the patient and their care. Some of those professions include nurses, doctors, pharmacists, physical therapists, speech therapists, nutritionists, dietitians, custodial staff, environmental services, care managers, social workers. There are so many individuals that contribute to the safe and effective care of a patient. And it's absolutely critical that we are able to work together as a team. We unfortunately don't often have the opportunity to train as a team. And some of the benefits of training as a team or interprofessional education is that it contributes to improved outcomes for patients. We find that patients stay healthier, they have shorter experiences in the hospital, and they receive better care when we work together as an efficient team. It increases role clarity. Everyone knows what they are supposed to do and how they are supposed to contribute to that team. It also contributes to job satisfaction. It decreases burnout. We see lower turnover rates. And so it contributes to improved outcomes for not only patients, but for staff as well. And so it is so important that we are able to train interprofessionally and that we are able to simulate together. But there are a lot of challenges with traditional simulation methods for interprofessional education. When we talk about traditional simulation methods, we're referring to mannequin-based sim. And there are a number of things that are really challenging when it comes to structuring interprofessional simulation with mannequins. First and foremost, it's very time consuming. It takes a lot of effort to move mannequins around, to put the moulage on them, to find the space available. It's very time consuming for staff and also for the participants. It also can be very complicated to schedule those simulations, given the number of individuals that might need to participate in that simulation. When we think back to really who those people are that participate, we would need a doctor or a provider, a nurse, a respiratory therapist, maybe a lab technician, social work. Coordinating all of those schedules can be very time intensive. And that can be a barrier to interprofessional education. It also is resource intensive. Both human resources and material resources. Takes a number of different staff members to facilitate these training sessions and tons of materials in order to set these up and run them efficiently. There's also a limit on the available space that institutions have access to. The required space to have multiple people or multiple mannequins to run an efficient and effective simulation is often just in excess of what is actually available. Faculty training can be another challenge. It takes a lot of training to be able to run an effective interprofessional simulation. And limited immersion can also be a challenge. Mannequins, as we can see depicted here, it's very difficult to convey emotion or real life, live time changes in physical condition. And so that can decrease the immersion that the students might experience in that simulation. So are there solutions? We've talked about all of these challenges with mannequin-based interprofessional education. What are some potential solutions? 3D virtual reality poses a really great solution for some of the challenges that we experience with traditional mannequin-based simulation. A brief description of what 3D virtual reality is it's a software that allows users to visualize, design, and control an object environment or any graphical element within a three-dimensional scope. It is immersive VR allows learners to explore the 3D and virtual learning environment and interact with entities in that environment. So the learner is fully immersed in a 3D virtual environment and can interact with that environment and other individuals and different tools as they would in real life. So how can that benefit interprofessional education? For one, VR is an extraordinarily portable solution for simulation. The equipment that is required for VR simulation is a headset and the pair of controllers that goes with it and a laptop to moderate that scenario. When we compare that to mannequin-based sim and the mannequins and the moulage and the hospital bed that you would need, all of the equipment that all of the different learners would need to interact with, VR is an incredibly portable solution. It also makes it very easy to schedule these training sessions because these simulations in VR can be set up anytime, anywhere, and learners do not need to be gathered in the same physical space. We'll demonstrate that a little bit later in this presentation, but your learners or participants do not actually need to be in the same physical space to sim together. So it makes it a very easy or advantageous solution for interprofessional simulation. It's also incredibly immersive. As we said, they are fully immersed in a 3D environment and able to interact with that as they would in real life. It allows for real-time communication with other participants in the scenario and allows them to practice interprofessional and interdisciplinary communication skills, delegation, and teamwork. It is reproducible very easily in that at the conclusion of a VR simulation, you simply need to press reset to start the experience over again. You don't need to clear the room, reset the mannequin, put everything back in its place, and then bring new learners in. You can simply hit reset and start the experience over again in a matter of seconds. It's also very easy for others who are not actually participating in the simulation to observe the simulation experience and learn from that as well. And we'll demonstrate how that's possible here in a moment. To show how this is possible, right here, this picture is showing an interprofessional simulation that we ran for an institution here in the United States. As you can see, there are 4 participants, each wearing a headset, and they all have a different role in this simulation. We have a resident physician, a healthcare assistant, and 2 registered nurses that are all participating in the same virtual simulation. You can see the first-person view of the resident physician casted onto the TV. So if you look at the TV in the back, that is what she is seeing during that simulation. And all 4 of these professionals are able to interact and care for this virtual patient. They're sharing the same physical space and the same virtual space. This scenario is controlled by a moderator on the left side of the screen, just with a laptop. And that is the extent of the equipment required for a high fidelity immersive simulation. You'll notice that there's no special room. This is just a classroom. We push some chairs out of the way. You can see them on the edge of the room there. And that's all we needed to run a simulation. Another picture to visualize this. On the left, we have 2 nurses that are both wearing a headset. They are participating in a virtual simulation, and you can see they're standing next to each other. The picture on the right is the view of one of these nurses. And you can see from the different colored, the orange hands and the green hands, that they are spatially next to each other in the virtual environment as they are in the physical environment. So what this means is they're able to interact with each other just as they would in real life. They can pass tools around, they can move around each other, they're not going to run into each other, and you can see what they're seeing. Now, we've shown a couple of examples of when learners and moderators are in the same physical space. This picture demonstrates the remote capabilities of virtual reality. This picture on the right shows 2 students wearing headsets. They are participating in a virtual simulation across campus in a whole separate building. The picture on the left is a classroom with a number of different students, all watching the screen. That screen is a direct visual of what the students on the right are seeing. And the moderator behind the computer at the front of the class is controlling that simulation from afar. So what this means is that moderators and participants do not need to be in the same physical space in order to have an interprofessional simulation in virtual reality. And it's also easy for others to observe that simulation, as you can see with these students observing their classmates in a simulation. So in practice, what this means and what we're going to show you is that we could have any one of you put on a headset all the way in India, and we would be able to participate in the same virtual training simulation all the way from the United States, halfway across the world. We'd be able to join that simulation as a participant or moderate it from afar. So learners don't have to travel to the same location. They can participate from where they are. So we are going to demonstrate this for you now. We'll have a live demonstration. I will pull up a simulation and share my screen. I'm based in Salt Lake City, Utah, and our participants in headset are located in Denver, Colorado, which is about 500 miles apart. And so you'll be able to see how even from 500 miles away, we're able to participate and have a collaborative learning experience together. So I will stop sharing my screen and get everything set up for our simulation. As you can see, we have Kendall Bailey and her husband Wade here. You can see them in headset. They're just in their living room. Again, no special space requirements, and they both have a headset on, and we will run a simulation with them. All right. Kendall, are you there?
Hi, can you hear me?
I can hear you loud and clear.
Wonderful. Welcome to everybody from Denver, Colorado.
Awesome. So as you can see here, we have this virtual space. There is a virtual patient and a virtual nurse in the room. And we can see we have Kendall here. Kendall, go ahead and wave so we know which one you are. And then we have Wade as well. Give us a wave, Wade. Awesome. So we can see that they are in the same physical space, but they're also sharing the same virtual space. And so we have a patient here, we have our handoff nurse here, and we're going to get a brief report from this nurse.
Hi, are you ready for handoff?
Yeah, we're ready.
This is Charlotte, a 30-year-old female. Delivery was augmented with oxytocin. She received no epidural. Delivery was complete after 2 hours of pushing. She's 1 hour post-normal spontaneous delivery of a healthy male. Only complication was retained placenta, which required manual extraction. Her current vitals are BP 96/50, heart rate 112, O2 sat 97%, respirations 20, temperature 98.9. She's had 3 pads saturated in 1 hour and is complaining of continued vaginal bleeding. Do you have any further questions for me?
No, thank you so much for the comprehensive report. We'll go ahead and start taking care of her right away.
Okay.
Hi, Miss Jackson, how are you? My name is Kendall. I'm going to be your nurse today, and I have.
Hi, Miss Jackson. I'm Wade. I'm also your nurse today.
How are you doing? Do you mind real quick if I go ahead and just check your name and date of birth for me?
My name is Charlotte Jackson. My birthday is December 31st.
Thank you so much, Miss Jackson, for confirming that for me. Congratulations on your new baby. How did delivery go for you?
I just had a baby. There were some problems with my placenta, and they had to pull it out afterwards. They said I'm fine now, but I don't feel fine. Something doesn't feel right. I feel weak and dizzy, and I'm bleeding a lot.
I am so sorry to hear that. If you don't mind, Wade and I are going to go wash our hands and get ready, and we'd love to come in and, take a listen to you and take a look and do an assessment. Is that okay with you?
Yes.
Okay. Wade, would you mind grabbing me some gloves as well? Thank you so much. Thank you. Miss Jackson, I'm going to go ahead and just remove your blanket real quickly, and Wade's going to go ahead and get some of your vital signs quickly so that way we can see what's going on.
Okay. Is it normal to be bleeding so much?
Of course, I can imagine that this is scary, Miss Jackson, but we're going to go ahead and take a listen to you and see what's going on. Okay, Miss Jackson. Well, it looks like your oxygen saturation is good. Let's take a look at the monitor here. I'm going to mute that for a second. Oh, Miss Jackson, it does look like your blood pressure is a little low. It also looked like your heart rate is a little high. So I'm going to go ahead and take a listen to your heart and lungs quick to see how you sound.
Am I going to pass out?
Good. Oh no, okay, let's go ahead. I'm going to take a look and see how your pad looks to see if there's any bleeding. Do you mind going ahead and lifting up your gown for me quickly? I'm all okay. Oh, and it does look like we have some bleeding there. I'm going to go ahead and feel on top of your uterus to see if it's contracting.
The uterus seems boggy and hard to find.
You're right. Miss Jackson, I'm having a little trouble trying to feel for your uterus right now. I think your bladder might be a little full. I'm going to go ahead and now, Miss Jackson, I'm going to go ahead and open up our Foley kit. I'm first going to go ahead and place some sterile gloves on. And I am going to go ahead and clean quickly. Okay. And I'm going to go ahead and grab our catheter, Miss Jackson, and I'm going to go ahead and use a little bit of lidocaine jelly. So this should help make it a little more comfortable when I insert the catheter, okay?
Okay. Thanks.
Perfect. So that catheter is in. Now I'm going to go ahead and I'm going to
Kendall, we may have lost your audio. Kendall, I think we lost your audio. Oh, now you're back.
Okay, can you hear me now?
Yes, we've got you.
And I see that Foley bag below your bed. You can go ahead and lower your gown down for us. Thank you so much. I'm just going to wash my hands after taking off those gloves. And I'm going to lower the bed. Miss Jackson, we are going to go ahead and call the doctor quickly. We just want to see if there's some other interventions we should do.
Okay.
Hello, this is the hospital operator. How can I help you?
Hi, can you please connect me to the doctor for Charlotte Jackson?
Okay, I'll connect you. Hello, this is Dr. Frank.
Hi, Dr. Frank. This is Kendall. I'm currently taking care of Miss Jackson. She's saturated 3 pads within the last hour and her uterus is boggy. I did insert a Foley catheter to help the bladder distension, but she is still bleeding and her blood pressure is a little bit lower and her heart rate's high. Is there anything else you'd like us to take care of for her?
Administer 250 micrograms carboprost IM now. Administer 1,000 milliliters normal saline IV bolus now, and then continue at 150 milliliters per hour. Arrange for a CBC and type and cross for 2 units stat. Prepare the patient for possible surgery. I'll enter these orders in the EHR.
Thank you. I think those are some great orders. I would also recommend that you come by and see the patient. I think that would help her too if you came and assessed her as well.
Okay, thank you. I'm on my way.
Wonderful. We'll see you soon. Wade, will you go ahead and check those orders? Because I want to make sure the doctor put those in for us.
Yes, on it.
Okay, great. Yep. So there we have our IM injection, normal saline, CBC type and cross. I'm going to go ahead and call laboratory right now to see if they can come up and draw that blood.
Hello, this is the hospital operator. How can I help you?
Hi, can you please connect me to...
Okay, I'll connect you. Hello, this is the laboratory. Okay, we'll send a lab tech to the patient's room.
I'm right here. Okay, thank you so much for inserting that IV. And let's get those IV fluids. Do you mind programming it 150 mLs per hour?
Just 1 second. 10, 20, 40, 50. Right. Yeah, it's right.
Great job. High five. Okay, I am going to go ahead. Will you pull up that tablet again so we can check this medication? I just want to make sure it's the right dose. Okay. So it looks like carboprost IM. Thank you. Perfect. Okay, Miss Jackson, I'm going to go ahead and give you this IM in.
Okay.
All right. So I think we have done all of the interventions that we're going to need for this case. So we'll go ahead and have Kendall and Wade take off their headsets. And then I'll show you guys what our moderator screen looks like while they're in this simulation. So while they were running this simulation, this is what the moderator sees during that process. I can see the patient's vitals at all times, even if the student hasn't put the patient on monitoring equipment yet. I can see all of the things that I can make the patient do. I can have the patient lift the gown, and that's in response to the students requesting it. I can have her lower the gown, assume the obstetrics pose, lower her legs, so forth. And I can also see these gold starred actions, which are critical actions, or things that they need to do in this simulation. Some of these the system automatically picks up, and others that I check off for them. I can also control the dialogue from this panel. So I can control the dialogue for our patient, Charlotte, and I can control the dialogue for our nurse in the scenario, as well as the dialogue for the telephone operator, the doctor, and the lab tech. So in this simulation, we were able to see 2 nurses participate in the simulation, interact with another nurse, interact with each other, interact with the patient, interact with a doctor, an operator, as well as lab tech. And all of that was done in Kendall's living room with a headset and a computer. And we did that with 500 miles between us. And it allows for this very immersive experience. I'm going to stop sharing my screen and go back to our presentation. And now would be an amazing time for some questions.
Thank you, Ms. Lauren and team, for this wonderful demonstration on OBG scenario. It was really enlightening on how VR would really help us in developing multi-skills, especially communications or like various skills for our nurses to enable them to practice effectively. It was really a wonderful one. Thank you all.
Yes, of course, we're happy to share.
So now it's quite clear how basically our technology is trying to revolutionize the education settings and also the healthcare settings with the example which was shown in the demo. Now, I would like to open the floor for questions. If the participants, the delegates have any questions, please put it in the Q&A feature so that I can moderate it. Dear delegates, any questions? So there's a question from Dr. Maheshwari. Ma'am's question is like, how do we emotionally connect with the patient?
Yes, that's an amazing question. VR is a great use case for emotionally connecting with patients and training soft skill development in healthcare professionals. As you could see in this scenario, the patient is able to express concerns and say, am I going to pass out? Is it normal to bleed this much? And we saw how Kendall and Wade very attentively answered those questions to the patient and helped her feel reassured. Kendall was also able to explain all the different steps of the interventions that she was providing to the patient and able to emotionally connect with the patient in that way.
Thank you, ma'am. There's another question from the delegate. How has the adoption of telemedicine impacted patient care in remote areas? It's out of the box question, but still it is related to the technology. I would repeat the question.
Yeah.
How has the adoption of telemedicine impacted patient care in remote areas?
I think telemedicine has had a very impressive impact on patient care in remote areas in that it allows patients that are in more rural areas or remote where they don't have as convenient or easy access to healthcare to receive consultation from a provider or from any healthcare professional and receive information from them, perhaps a diagnosis, consultation from them, and get the answers to the questions that they have. And so I think it's had a really strong impact there. Kendall, do you have any comments on that?
No, I think what I really like to see is now with a lot of our new technologies, we're really engaging and understanding that platform. This is a skill in and of itself, learning how to connect with individuals in a remote space. So using tools like this, even remotely, as we continue to have virtual conference spaces, it helps us understand that engagement with a patient across the screen. And so learning those skills is what we've really seen with telemedicine, as well as with these educational technologies.
Yes, ma'am, that's true. We have another question from delegate, Ms. Vidyashri. Which one can consider a primary skill in interprofessional skills? Which skill could be considered as a primary skills in interprofessional skills? Ms. Lauren, you would like to take the question?
Yes, sorry, my audio is cutting a little bit out. Kendall, do you want to take that one?
I will say that what we've traditionally seen from some of the early literature is that one of the biggest takeaways for interprofessional skill sets is communication. So having a technology that allows you to communicate in real time really does promote the development of that skill set. So that's really one of the biggest takeaways. And what I have found with using some of these virtual cases that do provide that real-time patient feedback, let's say I called the physician in this case and they escalated to me that, no, I don't need to come see the patient. I don't think that that's rightly needed right now. So then how, as the nurse, can I escalate my communication and have a place where we can understand each other to provide optimal care? So really the biggest skill set we've seen from interprofessional training is the advantages of communication, as well as what Lauren said about improving patient care outcomes. And there does seem to be a better correlation between patient care outcomes and interprofessional training and communication skill sets.
Thank you, ma'am. I think that answers the question. The next question is by Delegate Ashish. What challenges do you foresee in implementing emerging technologies for interprofessional education in nursing? And how can be this addressed?
Yeah, absolutely. I think there are always challenges with implementing anything that can be new or unknown. I think with VR in particular, I think the technology barrier can be a challenge for some people that might feel intimidated by new technology or something that might feel unfamiliar. It can be challenging to embrace something that feels unknown. But I think as we continue, experiences like this and why it's so important that we have more education opportunities to learn about these types of technology, I think we'll see that intimidation and that apprehension around embracing new technology um, become less of a barrier, become less of a challenge. Kendall, do you have thoughts?
No, I completely agree there. I think technology adoption, and that's really because it's just a new interface. I will say though, for many of you who don't know out there, my husband is not in the medical field. He has actually never been in a VR headset before today, but was able through a very short orientation with me get in and adopt it. And so finding a technology that's user friendly does help with that technology adoption. So that way your learners can purely focus on the clinical care and improving their skill sets in these high fidelity immersive environments and not focus on, I don't know how to use this. It's hard for me to use. So that way I'm pulled away from the learning. And so I think ensuring good orientations, but finding technologies that are easy to adopt for that workflow, even though it can be apprehensive, do support those learning outcomes. And what we've seen too, as many institutions and clients have adopted VR technologies, is that a really good just orientation and time to interact.
Thank you, ma'am. The next question is, with the emerging technologies, will it distance the therapeutic bond with the patient?
I believe we heard Lauren, distance our bond with the patient, especially with some of these virtual technologies.
Yes.
Yeah. At least Lauren, I don't know what your experience has been. What I have found in our technologies is we are actually able to showcase a variety of encounters that I think actually are supporting better effective domain development. So for example, patients who may escalate, patients who have unpredictable behaviors, patients who may have behavioral disorders, those are hard to mimic with a high fidelity mannequin, especially if they can't move or have those facial expressions. But when I get into a space like this that is very realistic, it makes me feel like, okay, yes, my patient is agitated. Yes, they are crying and I can see them crying in this immersive space. I need to work on those skills to be able to engage and support them. So even though it seems like we are right thousands of miles away from each other, I'm actually getting more nonverbal feedback from our patients that allow me to say, yes, I need to respond in a therapeutic manner. And then your facilitator, like Lauren in the case, can utilize dialogue to help cue you if maybe you are responding or maybe not responding therapeutically. So that way we can enhance those skills. And that's really, again, what we like to see from these emerging technologies is that cognitive and effective domain development.
Yeah, I completely agree with that. I think as we kind of spoke about earlier, with traditional methods and in simming with a mannequin, it can be very hard to develop therapeutic communication skills and empathy with a plastic mannequin. It can be very hard to practice those such important skills of the profession of nursing. And with something like virtual reality, where the patient can express themselves, they can emote, they can convey emotion, you have more of an opportunity in a learning environment, in a low stakes simulation experience to practice that. We find virtual reality is an amazing use case, as Kendall said, for learning how to de-escalate patients. learning how to have really difficult conversations, end of life conversations with patients, how to talk to a patient about how they feel getting put on hospice. Those are all really challenging conversations to have that it's so rare we get a chance to practice. And virtual reality provides that venue to practice that therapeutic communication.
Thank you, ma'am, for answering the question. We have a next question by a delegate, Ashraf. How do you measure the effectiveness of emerging technologies in developing interprofessional skills in nursing?
Lauren, if you don't mind, I'd love to kind of look at this here because I think that really comes down to the institution's philosophy on simulation and whether you're using it for that formative, real-time engagement with students, seeing what their critical thinking pathway is and finding a way to reframe it, or if you're using it more for that evaluatory summative assessment. I would say if we're really looking at this maybe from a cognitive perspective, what we've looked at and what we've seen many clients do is they may do pre and post quizzing on the topics and the learning objectives that have been done within the simulation case to see that learning pre and post. I've also seen some institutions that have really incorporated student evaluations, or they've done student assignments post simulation to really look at their reframing, their understanding of the clinical concept. And so that's where I've seen institutions more individually assign either concept maps, care plans, medication cards, SBAR reports, descriptions of the cases. And that way their facilitator or educator can really make sure that they're pulling away those larger skills and topics from the simulation. So I've seen that varied from institution to institution, dependent on how they've utilized simulation in their program and how they want to really evaluate those skills and progression through a program.
Thank you, ma'am. I think that answers that question as to how to measure the skills, what we are trying to develop. There's another question by Mrs. Geeta Badigar, ma'am. Could you explain about the cost affordability? I think this question was taken up last session.
Yeah.
Yeah, I think it's a very important question. I think cost is not a non-factor. It's a very important aspect of simulation and what a program is able to sustain as an option. What we find with virtual reality simulation as a solution is that it is far more affordable than traditional mannequin-based simulation. It's not uncommon for to need multiple mannequins, but also for those mannequins to cost an extraordinary amount of money. And we find that virtual reality, because the equipment costs are so low, again, you need a headset, the controllers, and a laptop, and an empty room. That's about all you need for equipment. And so the cost is far less than what we see with traditional methods, and needing to have a hospital bed, needing to have all of the staff available, needing tons of equipment for everyone to interact with, renting a space. And so we find it is far more affordable.
Thank you, ma'am. Thank you, Lauren, for answering the question. The next question is by a delegate, Vidya Bharati. It is about how it will be helpful for patients with virtual simulation comparatively to real-time nursing care.
I absolutely love that question because, and Lauren, I hope you don't mind, because that's always one of my soapboxes there, only because, again, I can speak to a lot of the context I've seen here within the US. And so hopefully this correlation is similar to what you might be seeing, but we have found within many of our patient care clinical rotations that our students aren't able to see the variety or the patient acuities we'd like them to see to have that vast understanding of the full spectrum of patient care. And so we might go to labor and delivery, or we might go to an ICU and maybe not have a patient rapidly deteriorate. right? We might not have patients who might deliver babies or have a postpartum hemorrhage. And those are essential skills that they may have to work through and incorporate with. And there was actually from the National Council at the Board of Nursing out of Canada actually did a large site study that found that virtual technologies and simulation were as good, if not better, than hands-on patient care, because of the fact that it was a low-risk environment for learning, that you could provide a variety of patient populations and acuities and allow for repetitive practice. So really what we find from simulation is it allows students that space that's risk-free to make mistakes, allow correction from a facilitator, and then when they do go in to provide that patient care, they already have the confidence and the skill sets to continue to apply those concepts in the actual surrounding and the populations they're in. So there are several studies that have been out there that say that they are very comparable for student learning and outcome.
Thank you, ma'am, for taking the question. We have a question by Ms. Rajeshwari. Do we have virtual simulation for all the advanced nursing procedures and emergency nursing management?
Well, I certainly can't say we have simulations for all of the advanced nursing procedures and emergency nursing management. But the library of scenarios that is available is quite extensive. One thing about VR, and we didn't really touch on in this presentation, is that VR is an amazing solution for development of critical thinking, clinical reasoning, decision-making, prioritization, delegation. It's a wonderful decision-making simulation platform. As far as tactile skill development or procedural development, the exact feel of how inserting an IV feels like, or what it does feel like to insert a Foley. VR is not the best platform for training tactile procedural skill development, but it is a wonderful platform to train the decision-making around those procedures. You'll get far more benefit training procedural skills on task trainers. That's where mannequins really, really shine. But with virtual reality, you get the opportunity to train the decision-making surrounding that procedure, as well as the soft skills of communicating your interventions with a patient, reassuring them, and explaining what you're doing to them and why, and how you're helping them.
Thank you, Ms. Lauren, for taking the question. We have another question. Ma'am, please tell me, during emergency time, how to maintain a proper communication with the patient? I think this question is on a real time, not on our topic, but still, anybody would like to answer?
So just to clarify, the question is really looking at during emergency care, how do we ensure that we're still providing effective communication to the patient? I will say both from a learning perspective and what we see, even tonight from the demonstration is we have what Lauren referred to as those NPCs, those avatar looking patients within the room. And with many emergency situations, many times your patient might not be the one who's responding to you. It's the family members in the room. And having these trainings where you as the nurse have to communicate empathetically to them and provide information to them. And those skill sets very much a part of that emergency response, looking at that for emergency care. So we teach a lot around emergency content, not necessarily for patient care, which we do, of course, managing pain and what the emergency response is, but including that there's a good family communication and making sure they're fully aware of the situation and involving them in that situation, which we can do within these virtual environments with those NPC additional patients, patient family members in the room.
Thank you, ma'am. We have another question where VR is being used for the patient. The question goes, Is it possible for a patient to get sufficient time to give experience during simulation? Because already patient is painful condition, how to come for effectively care? I think it mainly asks about patient care when we are using virtual simulation, not in education.
So just to clarify, is that when a patient is wearing a virtual headset?
Yes.
Yes. So virtual reality has actually proven to be a great option for patients for anxiety relief, for pain relief. And there are companies out there that create virtual simulations where a patient can be in the hospital, in a very unfamiliar and often frightening environment, put the headset on, and they're transported to a very tranquil meadow in the mountains, and they are able to experience some relief from anxiety and from pain. So we're seeing a lot of advancements in the use case for virtual reality in patient care itself, not just training of healthcare professionals, which is very exciting.
I think VR is mainly used in a rehabilitation phase than in an emergency condition. We have another question. Can we cover all the healthcare aspects with VR?
I would say, like Lauren kind of stated earlier, if we're talking about populations, different ethnicities, different clinical settings, home, public, hospital, clinic, yes, I think that VR technologies have the capabilities to provide those educational experiences. Again, looking more at that reasoning, cognitive thought, clinical reasoning, therapeutic communication, not necessarily the psychomotor skill set. But I do believe, because of its ability to build custom and unique environments, it does have the capability to provide a variety of settings and acuities that are needed to prepare students for the clinical environment.
Thank you, ma'am. We have a last question. How are mobile health applications supporting nursing practices and patient engagement globally?
By mobile health, is that more of like the telehealth component, or is that like mobile health, like you can engage with a provider over text message?
Yeah, it's mainly the mobile health applications, like it can be the apps what are being put in the app store.
Yep.
Or it can be even the mobile, like our WhatsApp communications, social media communications, how it is effective in supporting nursing practice.
Yeah, I think that's a really amazing question. I will say, just personally, that's not a lot of my scope for my expertise, really more in the educational realm. What I will see in practice, though, as a nurse, is because of those mobile applications where patients can send messages to their providers, many times nurses, nurse practitioners, advanced care nurses can communicate in real time to provide better patient support without the patient having to come in. You can provide better patient education and communication. And so what I have found, just in my personal experience in nursing practice, that these mobile applications just give patients better interface and communication with their providers, really actually engaging them more than the timelines we've seen where you can only communicate with your physician when you make an appointment within a clinic. And so if anything, I've seen an increase in the engagement with patients because of mobile applications. But again, that's solely from my experience within my nursing practice, not within my expertise, at least here for education and these emerging technologies.
Thank you, ma'am. Thank you, Ms. Lauren and Ms. Kendall, for answering those questions. That was the last question. So moving ahead, now I request our KLCC observer, Dr. Mohini ma'am, to address the gathering. Sorry to interrupt, ma'am. Ma'am,
Yeah.
your
It is unmuted. Yeah, my laptop it is not working, I think. So I am on mobile only. Yeah. Okay. A great appreciation for the organizers of this webinar. Can you hear, ma'am?
Yes,
Can you
ma'am.
hear? Are you hearing,
yes,
ma'am?
ma'am, we can
Okay.
hear.
Okay, okay. So a great appreciation for the organizers of this webinar uh, on emerging technologies in the development of interpersonal skills. So it has thrown light on the innovative technologies which are needed at this time for the nursing profession. And also I congratulate Miss Lorraine, and the session was very good. And especially the live demonstration was very, very excellent, extraordinary. And Sashikala madam, am I audible, madam?
Yes, ma'am.
Am
You're
I
audible.
Yes, ma'am.
Yes. Okay. Okay. So on behalf of representative from KSNC, Karnataka State Nursing Council, I award 4 credit points for this session, for this webinar, for the day before yesterday and today 4 points.
Thank you,
ma'am.
ma'am.
Thank
Okay,
you so
thank
much.
you, madam. Thank you, principal madam also.
Thank you.
Thank you, ma'am.
Thanks a lot, team, for organizing such an informative, absolutely insightful, and very engaging webinar. And I know that nurses have an enormous potential and they have a great learning potential. They can easily adapt to any challenges. Recently, I think we have seen with the COVID challenges. So I hope they'll be able to adapt to these technological development with intensive training and practice. Thank you once again to all the team, and especially thanking the speakers. It was a lovely session. Thank you.
Thank you, ma'am. As we come to the end of today's webinar, I would like to invite Dr. Prabhalis Thomas, Vice Principal, to address a vote of thanks.
Great evening to our speakers and good morning to everyone from India. Thank you is the best prayer that anyone could say. On behalf of Organizing Committee, KrupaNucon 2024, I, Dr. Prabhalis Thomas, Vice Principal, Kripanadi College of Nursing, would like to extend a heartfelt vote of thanks to all of you for joining us today for this enlightening webinar on emerging technologies in the development of interprofessional skills for nurses. First and foremost, I give thanks to God for blessing us with the success of this program. It is through His guidance and grace that we have been able to achieve our goals and make this event successful. I would like to express our profound gratitude to our distinguished speaker, Ms. Lauren Malmgren, Production Manager, CIMIX. Your insight into the intersection of emerging technologies and interprofessional skills have been truly inspiring. Your expertise and the practical examples you shared have not only broadened our understanding, but have also illuminated the path forward for integrating technology in our professional practice. Thank you, Ms. Lauren Malmgren. We are grateful to Ms. Kendall Bailey, Director of Nursing Innovation and Strategies, CIMIX, for sharing your expertise, and your demonstration on virtual simulation was truly exceptional. We deeply appreciate the effort you have taken to create such an informative and interactive demo. Your insights have provided us with a valuable understanding of how virtual simulations can be applied and its potential benefits. Thank you, Ms. Kendall Bailey. A special thank you to Mr. Joseph Tribble from CIMIX, who has been instrumental in arranging our resource persons for this webinar. Your dedication and effort in coordinating with the speakers and ensuring we had such knowledgeable and engaging presenters have been invaluable. Your behind the scenes work made it possible for us to deliver a session rich in content and expertise. We deeply appreciate the time and energy you invested in making this event a success. Thank you, Mr. Joseph. A
Thank you.
heartfelt thank you to KSNC Observer, Dr. Mohini, Principal SDS and TRC, RGCID College of Nursing, Bangalore. We deeply appreciate the time and effort you have dedicated to evaluate our webinar. Your feedback and insights will be invaluable as we work to enhance our future events. Thank you, ma'am. I'm honored to express our heartfelt thanks to our esteemed principal, Dr. Devi Samuel, for her valuable guidance and unwavering support. Your vision for advancing professional development and embracing technological innovations has been a driving force behind this initiative. Thank you, ma'am, for your support. I would like to express our heartfelt thanks to our wonderful moderator, Ms. Shashikala, Assistant Professor, Department of Community Health Nursing. Your exceptional skill in guiding today's discussion, managing the flow of event, and ensuring that everything runs smoothly has been truly commendable. Thank you, Ms. Shashikala. And of course, a huge thank you to our attendees. Your engagement, thoughtful questions, and participations have made this webinar a success. A special thanks to our organizing committee and technical support team. Your hard work behind the scenes ensured that everything went smoothly and that our digital experience was seamless. Your dedication is greatly appreciated. As we conclude, I encourage each of you take the insights and strategies shared today and apply them to your practice. Let us continue to foster collaboration, stay abreast of technological advancements, and work together towards improved patient outcomes and professional growth. Once again, I thank you all for your time and enthusiasm. We look forward to seeing you at our future events. Wishing you all a wonderful day. Thank you.